Clerk will report the amendment.
Amendment offered by Mr. Blumenauer of Oregon. At the end of the bill before the short title, insert the following section. None of the funds made available by this act may be used to implement Veterans Health Administration Directive 2011-004 with respect to prohibition on VA providers for completing forms seeking recommendations or opinions regarding a veteran's participation in a state marijuana program.
Gentleman from Oregon is recognized for 5 minutes.
Thank you, Mr. Chairman. I deeply appreciate the hard work of the committee to make sure that our veterans are properly cared for. They deserve our best. Too many are returning from Iraq and Afghanistan with obvious wounds, missing limbs. But over 2.3 million are returning suffering from wounds that are not visible. They are suffering from depression and PTSD. That's why we lose 22 veterans per day who take their lives, long since outnumbering the battlefield deaths. They deserve our best. Over 100 million people reside in the 21 states, including your home state of California, which was the first to legalize medical marijuana. 21 states and the District of Columbia have passed laws that provide for legal access to medical marijuana. As a result, as I say, over 1 million people now have access to it, including many of our veterans who use medical marijuana at the recommendation of their physician to treat conditions ranging from seizures, glaucoma, anxiety, chronic pain, and the symptoms associated with chemotherapy. There are also 9 states, including my home state of Oregon, that now allow physicians to recommend medical marijuana for the symptoms of post-traumatic stress disorder. I've heard those stories myself. I would ask unanimous consent to enter into the record one story that was in the NBC News on April 1st about Marine veteran Logan Edwards, who describes how access to medical marijuana may have saved his life.
The request is under general orders.
And, Mr. Chairman, any of my colleagues, whether they're in a state that's legalized medical marijuana or not, can find examples of veterans who are benefiting from this treatment. Yet the Department of Veterans Administration specifically prohibits its medical providers from completing forms brought by their patients seeking recommendations or opinions regarding a veteran's participation in a state marijuana, legal state marijuana program. The amendment which I'm offering today with Representatives Farr, Robacher, and Polis is simple. It ensures that no funds be made available to the VA to implement this prohibition. The amendment would not authorize the VA to authorize the possession or use of marijuana at VA facilities. It would simply free up VA providers to recommend medical marijuana or to provide advice upon it in accordance with state laws as they choose. Over 20% of those 2.3 million American veterans who suffer from PTSD or depression, and while there's no single approach to aiding our veterans with PTSD, we should not use an outmoded policy to serve as a roadblock to the path to recovery. We found that there are nearly 1 million veterans who receive opioids to treat chronic painful conditions. More than half of them continue to use it chronically after the treatment regimen. Another study found that the death rate from opiate overdoses among VA patients is twice the national average. The states where patients can legally access medical marijuana for painful conditions as an alternative, we shouldn't tie the hands of that primary provider or prevent our veterans from talking to their primary care physician. They should not be forced outside the VA system to seek a simple recommendation or to get information about these conditions or eligible conditions granted to them by state law. Our VA physicians should not be denied the ability to offer recommendations, advice that they think meets the needs of their patients. This shouldn't be controversial. According to a poll published in the New England Journal of Medicine, Over 70% of physicians have said they would, when appropriate, recommend the use of medical marijuana to their patients. We all know of people with violent nausea as a result of chemotherapy. Why would you deny that to our veterans, or at least being able to discuss it? Physicians, the support nationally for legalizing medical marijuana has also exceeded 70% in major national polls. This amendment simply allows veterans to consult with their primary provider, the same right enjoyed by over 100 million Americans today. I urge you to treat our veterans fairly and approve this amendment.
The gentleman's time has expired. For what purpose does the gentleman from Texas seek
I
recognition?
move to strike the last word.
The gentleman is recognized for 5 minutes.
Mr. Chairman, I rise in opposition to this amendment because even though I'm a strong believer in the 10th Amendment and public health and public safety is reserved to the states under the 10th Amendment, we're talking about federal facilities. And marijuana is prohibited under federal law. Any federal facility funded with federal dollars, I think it's entirely appropriate that it continue to be prohibited on a federal facility. This is an issue that should be left to the states, and nothing's prohibiting a veteran to go seek medical attention in a state where this is legal or where medical marijuana is permitted. They can certainly go to a private physician, and frankly, in the states where it's legal, they can, in some of these states, I think they're even working on vending machines for them. So I understand the gentleman's position, but again, these are federal facilities funded with federal dollars. It is prohibited under federal law. It is an issue best left to the states, and I think we would all do better as a Congress to honor the 10th Amendment and leave those issues involving public health, public safety to the states. And we ought to focus on the issues specifically delegated to the federal government by the Constitution and leave the vast majority of issues in the hands of voters, their locally elected officials, and state officials. This is certainly one of them, but when it comes to a federally funded facility, I think it's appropriate that the VA has a policy against their doctors prescribing or recommending the use of a substance that's prohibited under federal law. If they need it, they can go to the states where it's permitted. And I urge members to oppose the amendment.
The gentleman yields back. For what purpose does the gentleman from California seek?
Strike the last word.
The gentleman is recognized for 5 minutes.
I couldn't disagree more with my respected chairman. This is really a medical issue that ought to be in the hands of medical doctors. It does not allow them to prescribe marijuana. They can prescribe OxyContin. What this amendment does, it says if your state has legalized this for medical purposes, that as a doctor in a VA facility, you can have a discussion with a vet seeking medical advice on whether you ought to have access to, he can't write out the prescription. He doesn't have the authority to do that. It's a conversation. It's a discussion. It's a medical conversation. And I don't care whether you're for or against marijuana. That's not the issue here. The issue is, look, and Mr. Chairman, you know this issue from Eric Seastrand in our California State Legislature, who happened to be a Republican assemblyman dying of cancer, got up and made the most impassioned plea I've ever heard in my life on a legislative floor, saying members, and he was a pretty conservative guy. He said, when you're dying, don't deny us access to hope. The issue was about getting access to a prescription drug that hadn't yet been licensed. So I think we're in this debate now in this country, whether we like it or not. The voters of California overwhelmingly passed, and I think it was pretty much a senior citizen issue, that if we're having chronic pain and we think that medical marijuana can help alleviate that pain, don't deny us access to it. All this amendment says that if you're in a VA clinic and you want to have a discussion with your doctor about relieving pain or other things, you can have this conversation. And as a medical advisor, I think they want to have that authority. They can't do it in every state. They can't do it in every VA building, only in those states where the dialogue is going to be on the streets anyway. But they're not going to be professional dialogue unless you allow doctors to do this. This is a very simple amendment. Let doctors be doctors. Let them advise patients accordingly. Pass this amendment regardless of how you feel about marijuana.
Would the gentleman yield?
Yes, I'll yield.
Mr. Chairman, I listened to my good friend from Texas, and I'm troubled here. Why would we force veterans who are entitled to veterans' health and have a primary physician that meets their needs saying, but sorry, you don't get it in this case. Go out on your own nickel, go out and find a new doctor. We're not talking about prescribing it, we're not talking about using it on federal facilities. We're talking about giving access to information and having that conversation. I dare say there is no other medical condition, if it were polio or it were cancer, that you'd say, nope, go someplace else. Go on your own dime. Find somebody, build a relationship, who doesn't know your history, who hasn't seen you regularly. You're out of here. I think that is a disservice to our veterans. I don't think it is anything that, if you talk to veterans groups, if you talk to the people who benefit from it, that they think that they ought to be denied the ability to consult with their trusted medical facility provider.
Would the gentleman yield? Would the gentleman yield?
I'd be happy to yield.
We're talking about those. We're talking about those. If my good friend Sam Farr would yield.
Thank you, Mr. Chairman.
Very quickly, we're talking about those states where it's already been permitted, or either medical marijuana, or as in Colorado, and I think Washington State's already permitted it. It's a 10th Amendment issue. It's something that is left up to the states, but we're talking about federally funded facilities, and that's the concern here. In a federally funded facility where it's illegal under federal law, that's the problem.
No, it isn't. This is
federal funded facility.
Yes, and so you're going to tell the doctor, I'm sorry, you're in a federal facility. I can't talk to you about prescription of medical marijuana, even though you've asked my question. I can answer your question about abortions. I can ask you a question about OxyContin. I can mention your thing about alcohol. I can talk about any other kind of evil that may be in your mind or benefit that may be in your mind. But I'm prohibited by federal law, because I'm a doctor in this state working for the Veterans Administration, from having a conversation with you about medical marijuana. That just doesn't make sense.
Because it's prohibited
good.
By
it's not good medical practice.
Because it's prohibited by federal law.
Because it's prohibited by federal law, but not in those states. No. And I happen to be in a state where federal law ignores this, because law enforcement, medical folks, it's part of our system. We've worked out the regulations, and you don't see the feds coming in busting clinics in California or people using medical marijuana. You'd be busting a lot of senior citizens. So, look, we've got a hypocrisy in the law, and that's what this amendment's trying to clear up. I ask for an aye vote.
This time has expired. Is there further discussion? For what purpose does the gentleman from Colorado seek recognition? The gentleman is recognized for 5 minutes.
Oregon, I'd say to the gentleman from Texas, you are absolutely right. It is against federal law, and that's something that we as a legislature need to look at very closely. We're dealing with issues right now in Colorado. We've legalized the use of marijuana. In respect to certain banking laws, there may be a question of whether banks can provide services, financial services, to marijuana businesses, and as a consequence, cash is building up. So you may be absolutely right, I say to my friend from Texas. But the gentleman from Oregon really does, as does the gentleman from California, state a valid case from a medical point of view. And I would just say that I had a brother-in-law who had melanoma. And the only thing that gave him any relief was marijuana. Now, subsequently, he has passed away. But from a medical standpoint, there ought to be an opportunity for a doctor to consult with a patient to prescribe something that gives that kind of relief. So you are correct, Mr. Chairman, but I think we need to really take a good look at this. Colorado, we see a lot of people coming to Colorado to help treat epilepsy. And because marijuana may have some positive effects on epilepsy. And we need to take a look at that in a whole variety of ways.
Would the gentleman yield?
I would yield.
That's absolutely a valid issue for the states to take up. We should, all of us, honor that the 10th Amendment, the Constitution, delegates limited powers to the Congress. If it crosses state lines, interstate commerce, that's a valid federal concern. If it's using federal dollars, it's a valid federal concern. But that debate, you're exactly right, should be had at the state level. When it comes to police powers, public health, public safety, that's reserved to the states under the 10th Amendment, and I would absolutely agree with you. But in a federal facility, that's different. That's using federal dollars to talk about a substance that's prohibited under federal law. Right. I got a problem with that.
Reclaiming my time.
Thank you.
My friend from California would like.
I'll be asking.
You'll have your own time. With that, I'd yield back.
Gentleman yields back. For what purpose does the gentleman from California seek?
I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you very much, Mr. Chairman. I'm very happy to hear my good friend from Texas supporting the other legislation that we have that leaves it up to the states to make sure that they can declare marijuana legal or illegal. Very happy to have you on board. I rise in strong support today, however, of the Blumenauer, Farr, Rohrabacher, Polis amendment to the Milcon VA appropriations bill, which would essentially remove an unreasonable barrier that prevents VA physicians from recommending that our veterans have the benefit of state medical marijuana programs. The idea that VA physicians, totally legitimate doctors who treat veterans and their illnesses, cannot recommend marijuana, or by the way, any other drug, to their patients, and to treat things, especially when they're going to recommend that a drug that might be used in treatment for post-traumatic stress disorder. This is extremely troubling. Our veterans have benefited from using medical cannabis to treat PTSD and other ailments. So why are we denying our veterans the ability to access something through their health care provider that is available to the general public through access to their providers? The fact that our veterans cannot receive recommendations from VA physicians means that they are forced to go outside the VA system just to get a simple recommendation on a drug, restricting the freedom and ability of our nation's heroes, individuals who have sacrificed so much for our freedom to obtain medicine that their doctor believes would alleviate their problem and would be a treatment to an ailment that may be, and by the way, these ailments may be a result of a war that we sent them off to fight, but now to deny them the right to actually have their doctor give the recommendation that he thinks would help them is just simply not right. There are numerous physicians who believe that medical marijuana can have a great impact on these patients, on these veterans, on these people who are suffering, perhaps suffering as a result of the battles that we put them through. To fence off our veterans from such benefits is, as I say, simply not acceptable. I sincerely hope that all of my colleagues will stand up for patients and veterans by rejecting this heavy-handed government intervention into the doctor-patient relationship. Vote for this amendment and get out of the way of the medical judgment of VA physicians who are treating our veterans. Get out of the way. Let our VA physicians do what they believe is right for our veterans. That's what the issue is today. When we're talking about medical marijuana or other treatments, certainly our VA physicians would know more about that and have more concern for their patient than we here in Congress and those people who set up national rules have. So let's get out of the way, make sure we give the power and we empower the VA physicians to do their job. Our veterans deserve that from us. They don't deserve obstructionism between the United States Congress and their veterans physicians. I call on my colleagues to join me in support of this amendment.
The gentleman yields back. For what purpose does the gentlelady from Nevada seek recognition?
Move to strike the last word, please.
Gentlelady is recognized for 5 minutes.
Well, thank you. I rise in support of this amendment by Mr. Blumenauer, Rohrabacher, and Farr. I'm strongly in favor of it. The people of Nevada voted overwhelmingly to legalize medical marijuana, and in the coming months, the first medical marijuana depositories will go online throughout the state. At the same time, we also have a brand new VA hospital, which will be serving the veterans of my district and all across southern Nevada. Unfortunately, due to VA's current restrictions, the more than 250,000 veterans who call Nevada home will be unable to receive a prescription for medical marijuana through their VA doctors, and so they will not have the opportunity to take advantage of this available in Nevada medical option. This is just not fair, and I believe that the VA should have the flexibility. It's been said much more eloquently than I can by the sponsors of this amendment, but the VA should have the flexibility to recommend the best medical treatments available to our nation's veterans, especially if that treatment is approved under the state laws where the veteran lives. As a member of the House Veterans Affairs Committee, I regularly speak with both VA doctors and patients about advances in care for our nation's heroes. Forcing those people, those brave men and women who have sacrificed so much, now to seek outside medical evaluation to access legal medical treatments from doctors who have little or no understanding of the unique challenges that our veterans face is simply bad policy, bad political policy, and bad medical policy. We've already seen the positive results that medical marijuana can have for patients suffering from PTSD and other ailments associated with traumatic experiences such as combat. More studies are underway, including by the VA itself, that are anticipated to show these same kinds of results, and we've heard numerous stories firsthand. So I support this. I think it's common sense. It's bipartisan. We should move forward, and I urge my colleagues to join. And at this time, I would yield the remainder of my time to Mr. Blumenauer.
The gentlewoman yields the remainder of her time to the gentleman from Oregon.
I appreciate the gentlelady's courtesy and the points that she made. I heard my friend, the chair of the committee, talk about it being against the law. I am not aware of any place, and I would direct this to Mr. Culbertson, I'm not aware of any place in the statutes where it's illegal for our VA doctors to give advice to our veterans about a treatment that's legal in a state. If there's, what we're talking about is a prohibition that is a directive. So if there's a statute, I'd be interested in knowing about it. But even if it is, what if the advice that the VA doctor wants to give is don't use medical marijuana? They know their patient, even if it's legal in their state, they think it's not in the best interest of the patient. Your policy would prohibit that doctor from telling that patient, I think it's wrong for you. But I don't think it works. What is the wisdom of prohibiting? You're prejudging what the doctor would say. I think the doctor ought to be able to give whatever advice he or she wants to give. But I would redirect, I would yield to you if the gentlelady would permit. Where is it illegal under federal law for a doctor to talk about medical marijuana or any other treatment?
Does the gentlelady from Nevada yield?
I do yield. Thank you.
Where is that?
I would
illegal?
simply point out that a federal employee who's paid with federal tax dollars is obligated to follow federal law.
Right. Where is it in the federal law that it is illegal?
It's not. It's prohibited under federal law.
Where in federal law? I haven't been able to find that. Where is it prohibited for a doctor to give advice to a patient for a treatment that's legal in their state? Pro or con?
Certainly.
Where is that illegal?
In fact, my point is simply that a federal employee drawing his paycheck from federal tax dollars obviously is obligated to follow federal law.
Right. Where is that illegal under federal law?
It is prohibited under federal law, and that's my point. That is, in this case,
Could I
urge members to oppose the amendment.
I want to reclaim the time to make the point that the gentleman is wrong. I mean, I'm happy for him to show us where it's prohibited for a doctor to talk about a legal state treatment. There's no federal prohibition that we've been able to find, because if I could find it, I'd introduce legislation to repeal it. But my point obtained, what if the advice of the doctor is don't use medical marijuana, which is legal, because it's not right for you? I'm your primary physician. Why would you prohibit that?
The time of the gentlelady from Nevada has expired.
Thank you very much.
For what purpose? What purpose does the gentleman from Louisiana rise?
To strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, and Mr. Speaker, or Mr. Chairman today, and this very interesting discussion. I'm talking on this subject coming from the perspective of a physician and a military veteran himself, someone who is very acquainted with addiction disorders, someone who's been a medical director for addiction centers, even involved with methadone treatment over the years. And I can tell you that we all honor our veterans. We love our veterans. We are so glad that they have sacrificed what they have and what they go through. And we know about PTSD and traumatic brain syndrome and all of these things, which are a big problem. However, I would say to you, Mr. Chairman, that the last thing in the world we should be doing is giving medical marijuana to people with these disorders. What have we learned just in recent days? This month, the American Heart Association came out and said that marijuana, through their studies, both in young adults and middle-aged adults, has been shown to be very damaging to the cardiovascular system, leading to heart disease, congestive heart failure. You have a study right here. Also in this month, Northwestern came out with a study where they found that there was profound changes in the brain just among young adults who were using only casual exposure to marijuana. And we know on a biochemical level that addictive substances such as marijuana causes changes in the microscopic neurotransmitters. I wrote a book on that in 2007. So I would say to you today that one of the last things we should do is to damage the brains and the hearts of our beloved veterans. Why should we be hurting them? And as far as the claim that there's medical use for marijuana, where is the proof of that? What disease or disorder can be treated by marijuana and nothing else just as well, if not better? There is no proof out there. Trust me, I've been looking for it. There's a mention of treating seizures. Yes, University of Mississippi is doing a study extracting the oil, okay, not the THC, but the oil for the use for some seizure disorders. It's under experimentation. There's no proof that it does any good. And is medicinal marijuana anything other than recreational marijuana? Well, we have more dispensaries in California and Colorado than we do Starbucks. Now, do we have that many sick people in these states? I don't think so. So I come to you today as a physician telling you that having treated veterans in VA hospitals, one of the last things in the world we should do is give addicting substances to people with PTSD and other brain disorders. Any good physician would tell you that. Now, we have other anxiety-reducing medications that are non-addicting and work very well. Antidepressants do a very good job. But we know that if we compound a brain disorder or disease with an addicting substance that alters the brain itself, we're just going to see even higher rates of disorders, especially suicides. So I would challenge you today that we back away from this. Fine if we want to do some more studies. But medical marijuana, medicinal marijuana, we even have something called Marinol, which is prescribed sometimes under physician supervision. But medicinal marijuana is not under physician supervision. There's a script written out and somebody goes and gets high, okay? And the smoke from marijuana has more tar in it than cigarettes. Why do we want to have another epidemic of lung cancer and heart disease, for heaven's sakes, especially among our veterans? So I would say to you today, you can argue about the law, and I would say to the gentleman that yes, it would be improper to recommend to a patient to break the law by utilizing a Schedule I drug. It is against the law to use that, at least the federal law, and that I wouldn't advise a patient to go break the law. I don't think that'd be improper for me as a physician. as a physician to do that. So I would say to you today, we have a number of medical and health reasons that we don't want to hurt and damage the vital organs of our wonderful and beloved veterans. And that, again, if somebody has a claim that marijuana helps people medically, if it's so necessary and better than any other drug that we have on the market, well, then come forward with the proof. And the fact that there are doctors out there who say, yeah, I prescribe it for my patients, fine. But we have doctors who do a lot of things that I don't advise and many other doctors don't advise. It doesn't make it right. It only makes it right if we have proof out there, scientific evidence that supports its use and benefits. So again, I thank you, and I think this is a good debate to have. I know we're going to be talking about this more, but this does not belong in this bill. Let's protect our veterans, not damage them. Thank you, and I yield back.
Gentleman yields back. For what purpose does the gentleman from Tennessee rise?
Strike the last word.
Gentleman is recognized.
Thank you, sir. You know, what the gentleman said was a one-size-fits-all answer. The fact is, when I first spoke on this amendment, a similar amendment about DEA and marijuana, it was about a gentleman named Oral James Mitchell, Jr., a Navy SEAL, served this country in Vietnam, and died in 1996 of pancreatic cancer. And he violated the law in 1996 in the state of Maryland because he used marijuana to ease his nausea. And also, as his mother said, it's the only thing that allows Oral to smile and to eat. He didn't like the Marinol. He said it didn't do as much good as smoking marijuana. And when we're talking about somebody who has cancer and wants to use marijuana to improve the condition they're in and suffering from the nausea, and there's a lot of evidence that it's better than Marinol, then we don't have to worry about the situations that the doctor mentioned about possibly causing somebody heart disease over a period of years, which we know tobacco does, and it's sold all around and legal. We're talking about saving people pain, and we're talking about a VA doctor being able to distinguish between allowing somebody who might be in the last months or years of life and alleviating their pain with one of the best agents known to man to do that, rather than a situation where somebody might be young. We don't have that many veterans who are as young as the AMA study discussed and their ability to think. That was talking about kids who are teenagers. They're not veterans. So I would submit that there are times the doctor should have discretion. And we're not talking about the doctor dispensing marijuana. We're talking about a directive from the federal government prohibiting the doctor from saying, I think like Dr. Fleming, and I don't think you should use marijuana. I don't think you should go to another physician, if you could afford it, outside the VA system and try to get him to give you a directive to where you could go and get marijuana. This prohibits the VA doctor from allowing Dr. Fleming, if he worked at the VA, to tell his patient not to do it. The VA doctor should be able to speak the truth, and this is censorship by our federal government, a directive, which I think most of the people on the other side of the aisle have certainly been against federal government influence in medical policies and have done all they can to stop the federal government from influencing medical decisions. Here's a situation to where you're saying the doctor should be censored. So there's a lot of evidence that medical cannabis helps, but particularly with nausea. And I know the Speaker Pro Tem knows people in East Tennessee, as I know in Memphis, who have contacted me and asked me to allow them to be able to get medical marijuana. They can't do it in Tennessee yet. They'd like to do it in Tennessee at the veterans hospitals. But where it's legal in the state, the doctor should not be muzzled and censored. And this Congress should be in favor of the freedom of speech and the favor of the doctor being able to use their best efforts to help their patients and exercise their Hippocratic oath to do what they think is best, which may be to say no. I'd like to yield to Mr. Blumenauer to add to this discussion because he was exactly right. This doesn't say anything about dispensing marijuana. It doesn't say you're for marijuana. It simply says you allow the VA doctor to exercise their judgment.
I appreciate it. It's hard to improve upon your eloquence because you're speaking in favor of Dr. Fleming being able to advise a veteran if he was back at the VA to say, don't use medical marijuana. This directive would prohibit him from saying to his patient, no, don't do it, and reciting all the facts and figures. Why would we muzzle Dr. Fleming from his professional responsibilities one way or another in terms of medical marijuana? The literature is being built. I just have visited with dozens of medical professionals who want to do more research, who want to deal with this in a clinical, thoughtful way. We've got stupid federal policies that prohibit the research. I've met with parents who have children with violent epileptic seizures, and they're moving to states where they can get medical marijuana because I will on somebody else's time, because they can get it. But the physicians cannot get medical marijuana to study, but it's making a difference for these families. And we just ought not to confuse what we're talking about here. We're talking about VA hospital doctors being able to do something that's not prohibited under federal law, which is talking about the pros and cons of treatment. That ought to be our objective, and that's why this amendment should be approved.
Time of the gentleman from Tennessee has expired.
Thank you.
Question is on the amendment offered by the gentleman from Oregon. Those in favor say aye. Aye. Those opposed say no. No. In the opinion of the chair, the noes have it. The amendment is not agreed to.
Mr. Chairman.
The gentleman from Oregon.
I would request the yeas and nays.
The gentleman has requested a recorded vote to pursuant to Clause 6 of Rule 18. Further proceedings on the amendment offered by the gentleman from Oregon will be postponed.
Requested. Those supportive request recorded vote will rise and be counted. Sufficient number having risen. Recorded vote is ordered. Members record their vote by electronic device. This is a 2-minute vote. On this vote, the yeas are 195, the nays are 222. The amendment is not adopted.